Good morning. I'm Steven Pavlectic. I'm absolutely delighted to be here at ASH and having this opportunity to meet people from the newly evolving GvHD hub. We truly look forward in the bone marrow transplant community, particularly those who deal with patients with graft versus host disease, to better venues and opportunities for education to disseminate the growing knowledge and the opportunities that are offered now to our patients with the advances in treatments and learning about biology. So we are here at the American Society of Hematology annual meeting in Atlanta, and of course there are a number of sessions that are covering as well area of hematopoietic stem cell transplantation, and particularly the problem that we are dealing with, graft versus host disease. That's one of the main immunological barriers to the success of those transplants. So I would like to review few key presentations that I thought they were most interesting out of many. As you know, my focus of my clinical activity and research has been in chronic graft versus host disease. So I will start from that end where remarkable developments have been occurring during recent years in terms of availability of novel treatments, creation of networks. We had a first FDA approval of an agent, first time in history for chronic graft versus host disease. It's lots of attention has been given to this area. So there was an abstract completed 2 levels of treatment using a novel molecule. It's the ROCK2 inhibitor for chronic graft versus host disease patients that failed standard therapy, so for salvage. The drug is interfering with a key pathway in the pathophysiology of chronic graft versus host disease that targets particularly those that create ultimately fibrotic changes that are very disabling in patients. So that new drug has been used in a early clinical trial, 2 dose levels, level 1 and level 2, with a quite great promise. And the dose escalation is continuing, but what's been quite catching our attention is, of course, the promise of efficacy in this early stage, but as well as quite remarkable tolerability of this agent. So really, that was actually a poster at ASH, and really look forward to the completion of that study and more extensive data in patients. Moving on the trajectory of GvHD earlier on, after transplant, acute graft versus host disease, so complication that occurs earlier on. The main observations I would emphasize are in the area of prevention of acute graft versus host disease that have been presented as oral sessions at this ASH meeting. One is the approach of T-cell alpha, beta, and B-cell targeting for depletion of the graft. And the studies have been presented in adults from Germany and in haploidentical transplants with very good promise and safety. And it's definitely that strategy. As we know, it's been always challenging to have successes in haploidentical transplants. It's, I think, right now head-to-head moving forward, and it remains to be seen, is this one going to be more beneficial than the other strategies? They're very popular with post-transplant high-dose cyclophosphamide. The other interesting study in prevention of acute graft versus host disease is the early results of a trial from Seattle, from the Fred Hutchinson Cancer Research Center, of using the CTLA-4 Ig blockade, so co-stimulatory receptor inhibition of T cells in prevention of acute graft versus host disease who received grafts from mismatched unrelated donors, a very difficult population to prevent, and this initial data are offering hope that we may be able to decreasing the most lethal and most dangerous form of acute graft-versus-host disease in this very difficult patient population that usually we are talking about patients that don't have suitable, well-matched, related or unrelated donor. The third thing I would emphasize that it's important that occurred at this ASH is entering of T regulatory cells in the form of cellular therapy for acute and chronic graft-versus-host disease. So there were 2 studies presented from Dana-Farber Cancer Center in treating steroid refractory acute graft-versus-host disease with low-dose IL-2 and T regulatory cells selected, and as well as for chronic graft-versus-host disease. Particularly this acute graft-versus-host disease study used infusion of cells with low-dose interleukin-2, and I find this interesting because finally we've been talking a long time about the role of T regulatory cells that suppress inflammatory reaction of graft-versus-host disease, but this is now the first time that we are really seeing something entering more substantially in patients. And I would conclude here on the area of possible developing better strategies for stratification. So the idea is that you can treat more aggressively patients that are high risk of developing lethal and dangerous forms of acute graft-versus-host disease. So there was a very nice multi-center trial presented from Germany in using the proteomics platform from urine samples. What's important for patients, if you can develop biomarkers using the urine sample, so you don't need to obtain blood, so it's a convenience. And this study showed that actually it's validating prior earlier data that using the proteomic based biomarkers assessment in urine, it's very good in predicting who is going to do poorly in acute graft-versus-host disease. This particular study didn't show as much in terms of outcomes, in terms of targeted and stratified intervention. But what I find very important that we have this simple test that now they can serve us quite reliably in designing future trials for acute graft-versus-host disease prevention with novel drugs that are coming at our hands.